Hello everyone, how are you all? Hope everyone is doing good. So, last class up to patient advocacy we have discussed. So, if anyone is having any doubt, let me know in the comment box or else in my email. And if any suggestions are there or if I need to take any subjects or topics, let me know. So, let's move to the topic. Today I am going to take current status of child health in India. So this topic actually it's like historical topic. Okay, so if you need to study, you just know about the outline. It's really hard to know each year and the percentage, right? So just study the outline. So here what says is, in the year as per the census, Indian population in the year 2011, 1.21 billion were there. In 1.21 billion, 0.62 billion males and 0.588 females were there. Okay, and in Kerala, the infant mortality was 6 per 1000 live births, and in UP 64 were there. So mortality rate is nothing but death rate of the infant. And there are great inequalities in health between states. So it's not equal. Inequality is nothing but it's not equal in each states. So inequalities in health between states were there. So we see in major health indication, that is the life expectancy at birth has increased from 4.7 years in 1970 to 1975 to 67.9 years in 2010 to 2014. So from the beginning 49.7 was there, then it increased to the 69.9 years. Alright, for the same period, life expectancy for females were 69.6 and for males 66.4. In 2018, they said life expectancy at birth is said to be 69.1. So it's increased, right? And the second point, the infant mortality rate has declined from 74 per 1000 live births in 1994 to 37 per 1000 live births in 2015. So 1994, 74 persons it was the infant mortality rate, and in 2015 it reduced to 37 per 1000 live births in the year 2015. Okay, however the differentials of rural and urban still high, because in rural we see 41 and in urban 25, so it's still high. And in 2016 the infant mortality rate was to be 34.6 per 1000 live births. So in 2016 34.6. Alright, the next is the under 5 mortality rate for the country was 113 per 1000 live births in 1994, whereas 2018 it reduced to 41.1 per 1000 live births. So in the year 1994 we see the mortality rate of under 5 children, it was 113 of 1000 live births, and it reduced in the year of 2018, that is 41.1. So next is the maternal mortality ratio has declined from 212 per 1 lakh live births in 2007 to 2009. So the maternal mortality, this has been reduced from 2012 to 167. Okay, so in between 2007 to 2009 the ratio was, or else the mortality rate was 212, and in the year 2011 to 2013 the mortality rate was 167. So from 212 to reduced to 167. Got it. However, the differentials for state Kerala 61 and Assam 300 as of 2011 to 2013 are still high. So in Kerala and Assam, it's still high in the year of 2011 and 2013. So the next point is the total fertility rate for the country was 2.3 in rural areas and 1.8 in urban areas in the year of 2015. Okay, so comparatively the rural areas are more, that is 2.3. So the next, the most common cause of disability adjusted life years, that is DALYS, lost for Indian citizens as of 2016 for all ages and sexes was ischemic heart disease, second chronic obstructive pulmonary disease, third diarrhea, fourth lower respiratory infections. So in the 2016 year, all ages and sets, they had these kind of diseases. As per the figures about the child mortality rate, which is quite big hurdle for the government, second most common cause of DALYS lost for children under 5 of age was disease like diarrhea, lower respiratory tract infections and other communicable diseases as of 2016, which can be preventable. So from the beginning, these ischemic heart disease, chronic obstructive pulmonary disease and diarrhea, then lower respiratory tract infections for both males and the females, they were affected. But later we see under 5 they also had these kind of infections or else these kind of diseases. Okay, so I hope everyone understood this topic. So under 5 and the other ages, they also suffer the same disease. Even under 5 children also suffer the same diseases. So in the year 2016 we see 8.66% of total DALYs. Alright, so this comes under the major health indications. So next is health issues. Okay, so health issues I will tell in the next class. Under health issues, again malnutrition, then other forms of malnutrition are coming, and then communicable diseases there, then a high infant mortality rate is there. So these and all we study in the next class. Alright, so if any doubts are there, let me know. And if you need, I have already shared the notes, so you can just take down or else you can just take the screenshot. So study well, all the best, and thank you. Have a nice day.